Access to advanced healthcare has been made much simpler for patients in this region by virtue of the fact that Christ and Premier are partnering to bring the expertise of Christ Hospital's protocols to the community-based practice that Premier has established in this area. So the main advantage for patients in the South Dayton and Northern Cincinnati areas is that the evaluation of the patient's condition can be done geographically closer to home, and then a decision can be made about which location will be the most optimal for the patient in terms of receiving care. Two healthcare systems work incredibly well together, in large part because all communications between the two have really been streamlined, such that there is tremendous ease of access for any physician at any location to be able to make contact with another specialist who can provide then the information that's needed to evaluate the patient and make a decision as to what the next step should be in that patient's care plan. The collaboration between the Christ Hospital and the Premier Health System is allowing physicians to create a plan for patients in a truly multidisciplinary way. And this is accomplished by direct communications, video conferencing, a multitude of media options that allow physicians from different specialties to come together, either in person or virtually, to create an individual plan for the patient. This joint partnership between Christ Hospital and Premier also allows a patient to have a geographically convenient point of entry into the system, and then evaluation with regard to possibilities for new technologies or advanced therapies. So this partnership grants patients access to a variety of advanced surgical techniques and heart failure procedures. This collaboration allows us to bring evidence-based practice of medicine to each patient one at a time and individualize their care. All the patients I've operated on so far have all lived in this region and have really appreciated being able to be cared for closer to home, and it's allowed their families to be an integral part of not only their hospitalization, but especially their recovery, which is very, very important after surgery of this magnitude.